Hi everybody, today we'll be discussing about abnormal nephrogram. First one is the striated nephrogram. Here you can see axial images. Here is the spine. Here it is aorta, IVC and axial sections of the kidney. What is striated nephrogram? There will be alternating bands of high and low attenuations. They'll have a radial arrangement extending from renal capsule to the papilla, similar to the collecting ducts. What are this? These low attenuation bands are mainly due to here the collecting tubules, they don't have any contrast. Due to no contrast, they will not enhance, or it may be due to edema between the nephrons. Due to this, there will be low attenuation bands. Why there are high attenuation bands? High attenuation bands might be, this may be a normal attenuation of the parenchyma, or it may be due to hyperattenuation due to tubular obstruction. There may be tubule obstruction. Why there is tubule obstruction? Tubule obstruction may be due to pus causing tubule obstruction in pyelonephritis, or due to proteinuria or myoglobinuria. What happens when there is obstruction? There will be more, the water get absorbed. There is absorption of the water and the contrast gets accumulated there. Due to high concentration of contrast, there will be hyperattenuation. This is due to high attenuation band. So what are the causes of striated nephrogram? Most important causes are pyelonephritis. Other causes are renal confusion, hypotension, autosomal recessive polycystic kidney, urinary obstruction, renal vein thrombosis. These are the causes of striated nephrogram. Then coming to rim nephrogram. This is one more abnormal nephrogram. What is this rim nephrogram? It is seen mainly in occlusion of the renal arteries or veins. Here you can see a coronal section. Here we have spine. We have two kidneys. These are all normal enhancement. This part is not enhanced. There will be absence of, in cases of renal infarction, where there is renovascular cause, there will be no enhancement of the renal parenchyma here, except for the subcapsular region. Mainly in these cases, what happens? The thin rim of 2 to 4 mm peripheral band of cortical opacification will be present in the subcapsular region. Why only this part is enhancing? Because it gets a blood supply from capsular arteries. Even not only the subcapsular zone, there will be enhancement centrally in the cortex adjacent to the medulla. This part also will be enhancing. Remaining part will not be enhancing. Why this part will be enhancing? Due to collateral blood flow from the periurethric or peripelvic vessels. This is the rim nephrogram. It is seen in its renovascular causes. We have reverse rim sign. What is this reverse rim sign? Here we have a coronal section, contrast enhanced images. We have spine and we have both kidneys. What happens here? Reverse rim enhancement. Here only the medulla enhances and renal cortex is not enhancing. So enhancement of the renal medulla will be there and cortex will be absent. This is mostly seen in acute cortical necrosis. Subcapsular region enhanced due to collateral blood flow. So what are the causes of this acute cortical necrosis? Prolonged systemic hypotension. It may be due to obstetric causes or sepsis, post-transfusional reactions, hemolytic uremic syndrome, transplant rejection, severe dehydration. In these cases, there will be reverse rim sign. Thank you.